Welcome to the Age Gracefully Show with Dr. Michael Grossman, the well-known anti-aging stem cell and regenerative medicine specialist, best-selling author, and founder of the OC Wellness Clinic in Irvine, California. Each week, he shares the latest information to help you look and feel your best so you age gracefully. And here's your host, Dr. Michael Grossman.
Hi, Michael Grossman. I'm an anti-aging physician, and we're here to talk today about sexual dysfunction in men and women and how we can treat it and understand why it's happening and what we can do about it. So I do a lot of work in this arena of sexual dysfunction. It's a very important problem. It's not just a feel-good kind of thing. Your health is very connected to relationships, and relationships are foundational with regard to sexual functioning. So it's a real important kind of a medical problem. Now, when we think about sexual dysfunction for men and women, sometimes we're misled to think that it's mostly psychological, but in fact, it's mostly physiological. It's real obvious in men in terms of the physiology. In men, if you have diabetes or prediabetes, if you have blood pressure issues, if you have clogging of the arteries from cholesterol and other inflammatory issues, the first area of your body that it affects is the erection functioning. For men, the smallest artery in the body is really the penile artery. It's a very tiny artery. And as soon as it gets a little clogged up, it doesn't work. Things don't function like they're supposed to. So it's really like the canary in the coal mine, that if your erection functioning is not working properly, then we know that you probably have other issues going on that are causing that to happen. And those other issues can be any one of those things that I mentioned. Now, one of the ways that we know whether sexual functioning for men is psychological or physiological is, are you having an erection in the morning? Most young men have erections every morning when they wake up. And if they wake up during the night, they're having an erection. This is not a psychological phenomenon. These erections are physiological. You're not getting excited during the night when you're sleeping. It's just a physiological phenomenon that you're getting a firm erection. So when it doesn't happen, it's because there's a physiological problem going on. Now, other issues that could be going on relate to hormones. So as men and women get older, you lose hormones. You're losing testosterone in men and women. And testosterone is critical for normal sexual functioning. So if 50, 60, 70 years old, and your hormone levels are way down and they're very, very low in testosterone, you're not going to have the ability to have an erection. And you're also going to lose libido. So some men who have erection functioning problems will find that they have desire, but the mechanics don't work. And other times they kind of lose the desire. They just, well, it's no big deal. I'm not so interested. But the lack of interest is not a psychological issue. It's a physiological issue because you're losing testosterone. And when you lose testosterone, you're also losing your mental enthusiasm for things, for conquering, for achieving, for setting goals, for feeling like, yeah, I can do it. That's testosterone. And that's testosterone for women too. You need testosterone. Now, women only have 1/12 of the amount of testosterone that a man has, but they need it. They need that testosterone to feel. So for women, there's a lot of physiological reasons why they can also lose the ability to have orgasm, to feel sensual pleasure, to find that their sexual functioning doesn't work. So for women, not a problem with vaginal dryness and discomfort with sexual activity, because the vaginal lining is like the mucus lining of the mouth. and it's supposed to be nice and lubricated. And you lose that when you don't have estrogen, you don't have progesterone, testosterone, and then the vaginal lining gets very dry and very thin, and sex can become very painful. That's not psychological. That's easily treated with topical hormones, rubbing it into the vaginal area to actually rejuvenate that area and get it to be youthful again. Now, for women, testosterone is critical for the desire, but for the actual experience of sexual functioning, to experience orgasm, there's a variety of things that can be helpful for women. One of them is oxytocin. Oxytocin is a very important hormone for women. When women produce oxytocin when they breastfeed, but you also produce oxytocin when you have orgasm. So for women, and to a good extent men, oxytocin can be very helpful to have the ability to have orgasm. And it's a hormone. It's not a psychological thing. So that's something that's helpful for men and women to experience sensual pleasure. Now, there's other hormones that can be very important. One is PT141 is a peptide that releases hormones from the pituitary gland in the brain. And PT141 can be very helpful to increase the experience of orgasmic pleasure. And again, it's not psychological. It's a little teeny injection you give yourself a couple of times a week, and it can really change the experience of sexual pleasure. Now, there's a variety of other things we can do to experience and to improve, and we've talked a little bit about it in the past, to improve the experience of sexual functioning. We can repair damage that occurs in male and female sexual reproductive organs over a period of time. So for men and women, sometimes it's just the aging process. Sometimes it could be some particular injury. Sometimes it could relate to childbirth, where things tear and stretch and get injured. For men, it can be a variety of issues that occur that create that inability to have orgasm and lose the erection mechanism. Sometimes it's just the nerves get injured for various reasons, and you don't feel the sensation that you used to feel. So we have several mechanisms. One, we talked about the P shot and the O shot. These are platelet-rich plasma injections. Take your own blood. We extract the growth factors that are naturally in the blood, and we inject it back into your body. It's not really painful. It's like a little blood test. It doesn't really hurt much, just little pinpricks. But the platelets are the natural way the body will stimulate your own ability to regrow and repair damage that has occurred. For whatever reason the damage has occurred, the body doesn't care, it just repairs it. So we can inject it into the penis for men, including into the skin of the penis to increase sensitivity, and into create the erection mechanism. And for women, we inject it into the vaginal area where the nerves are, which allow the woman to feel more pleasure, and also inject it into the clitoris area where you actually have the increase in, and that's the equivalent of a man's erection. The woman gets erect in the clitoris and the blood comes in, and then you can experience orgasmic pleasure. So these are easy things to do that I do all the time, and it works 80% of the time fantastically well, and men and women really feel dramatic benefits from it, and it lasts for a long time. We also have the Gainswave procedure that we've talked about in the past, where we use vibrational waves, intense acoustic waves that vibrate the area very intensely, and it brings repair cells in the area. We kind of fool the body into thinking there's some damage occurring, and the body sends in repair cells, and it repairs, and it just rejuvenates that area that's been injured. Again, very, very harmless treatment, very, very easy. Now, other things that we do that can be helpful, we use the Viagra Cialis type of tablets, which are not a cure for the underlying problem, but can be very helpful to uh, allow the erection mechanism to occur where otherwise it might not. Even though it doesn't repair the underlying problem, it does help to allow normal erection functioning to occur. We also have something called trimix, which is an injection which will, if nothing else is working, allow you to have a artificial erection, which can last for an hour or so. And it's a little injection that you do into the penis that can be very helpful. And we use this as like a temporary, at least I do, it's a temporary thing while we're repairing the underlying problems to at least to allow the erection mechanism to occur. And so I will end with this idea that the whole idea of sexual functioning is not just for your temporary pleasure, but it's actually physiological, very, very important for your health. There's so many studies showing that good sexual functioning in a healthy romantic relationship is the glue that keeps the relationship together. And it has so many health benefits for your blood pressure, for heart disease, for longevity, for psychological health and well-being. And it cements that relationship together. And we find that masturbation is not the same as sexual pleasure among a romantic man-woman relationship that's ongoing, where you're feeling emotional attachment to the other. It creates all these hormonal changes in your physiology, which brings about a huge amount of health benefits. So this is just to encourage you to be aware of all these options that are possible now with the anti-aging rejuvenative medicine approach that I do. And it's something that I encourage you to take this information and consider if this is going to be helpful for you or in your family, in a marriage relationship. It's very, very important to maintain sexual activity, to bring fulfillment in your romantic relationship. So come and visit me if you like. You can call my office, 949-222-0232. And you can go on my website, ocwellness.com, and see all the different things that we do and get more information. So it's a pleasure talking with you. Look forward to talking with you next week. Thanks so much.
Thank you for watching the Age Gracefully Show with Dr. Michael Grossman. Join us next week for another informative discussion to help you age gracefully. Be sure to visit us at ocwellness.com.